Welcome to another episode of BAVNAH News and Information brought to you by the Bennington Area Visiting Nurse Association in Hospice. One of Bennington area's best kept secrets is the fact that BAVNAH offers a fast and convenient travel clinic. Here to talk to us today about travel health and travel clinics is Cathleen Paulin. Welcome back to the show.
Thank you for having me, Mark.
And Kathleen, you are what with the agency?
I wear many hats. I do the travel health clinic. I run the community occupational health office, which we have all kinds of programs, including our foot and our flu and our cholesterol clinics. But travel health is something that we've been doing for a while, and it is a very well-kept secret, and we're really just trying to reach out there to let people know that we're here.
And you are a registered nurse yourself.
Yes, I'm a registered nurse, and for the travel health clinic, we actually had to take a 3-day course with a woman, Gail Rosselet, down in Westchester, New York, who is world-renowned. She actually trains people at the CDC for travel health type things.
Okay.
So had to go and sit and learn from Gail. It was a fun time.
Well, what started it? Why did BAVNAH want to start? And for people who are still learning what BAVNAH is, it's just the abbreviation or the acronym for Bennington Area VNA and Hospice. Why did they start the travel health clinics? What was the reason behind it?
Well, much like up at our Rutland branch, people had to travel quite a distance. You either had to go to Brattleboro or Fletcher Allen or Dartmouth, and these larger places, it's harder to get in. Sometimes it takes several weeks to get in. Sometimes if there's shortages on vaccines, they don't have them because they do such a large volume. So we wanted to be able to, keep people a little closer to their community and offer this service so that they didn't have to travel quite as far. We also were able to then work with their physicians if we needed opinions or prescription medications called in, which kept it nice because when it's too far away, there's not that connection.
Right, right. And so this can be done in the office, or do you have to go to their home, or how does that work?
Typically, we have people come to the office, but if we have a large group, Castleton approached us at one point. They were taking a large group of students overseas, and they needed to get some vaccinations. So we offered to come to the school and do a large group education, and then the vaccines for the people after the fact, all in one shot. So
that's fantastic.
We can tailor it, but for the most part, for public, you come into the office.
So why is it important to plan ahead for traveling?
Well, I never knew this until I took the class. So there's a lot of things that are vaccine preventable that even people don't realize they should be considering for places like Mexico. And when you start traveling to places that are not quite as industrialized in India or Africa or South America, there are some vaccines that are very specific to areas that you should consider to keep yourself healthy. And on top of all of that, there's a very longer than my arm list of things that are non-vaccine preventable, and that's often what gets missed. And then on top of that, if you have a long flight, there's things to consider about being in the air that long, to keep yourself healthy. A lot of people don't realize sitting there, your legs get all swollen. You can actually prevent that from happening by wearing compression socks or doing some simple exercises sitting in the seat. So if you don't travel a lot, there's a lot of little things that you might not be aware of. And we want your memories to be happy, not, oh yes, I sat at the ER or I had to put my feet up at the hotel because I felt like crap afterwards.
So this travel health is even more than just immunization and shots. It's kind of an education on how to travel healthy.
Yes, yeah.
Wow.
It's one of those things that I think people just don't understand and they miss. And I hear people in the office saying, oh, I'm going to go off to here, I'm going to go off to there. And I'm always curious to go, I wonder if they're aware about.
Well, and you mentioned something too before about, traveling to different countries, different locations. So somebody who has the training background and somebody who's a nurse, you probably have to stay up on top of what is going on in the world for people who are traveling somewhere to know that, okay, this is the biggest outbreak, maybe not outbreak is the right term, but illness that's affecting this area right now. This is what's happening in this area right now, because they're not all the same. There could be something going on. And so for somebody who's traveling to that area, they could call up and talk to you, or talk to their physician, talk to you, and then find out what is actually going on in that area, because I'm going to be traveling there.
Right. So it's a lot like right now the Zika virus. Everybody's hearing about it. It's a nasty little mosquito bite. It's in certain areas. They're finding out more and more about it, but Zika's been around for a long time. So there are things like that that don't necessarily make national headlines that you should be aware of. Japanese encephalitis is another mosquito. A lot of people don't realize that's out there. They think of yellow fever and malaria and traveler's diarrhea. That's it. When people start traveling, those are the big things that come in. But there's a lot more that we can offer to help keep you safe. So travel safe and educate.
So because I don't travel a lot, when would be a good time to start the conversation and who to start the conversation with? If, let's just say, okay, I know next year I want to go to Mexico. Or let's say I work in a business and next month I have to travel to Mexico. Is there an appropriate time? Is there a time limit?
There is a time limit if you want the absolute maximum, 6 months before travel.
Okay.
Because some shots require multiple injections.
Yep.
Hepatitis B and hepatitis A and Japanese encephalitis and rabies are all multiple injections. The hepatitis B is 3 shots. You get one on day 0, day 30, and then on the 6-month mark. So that's why I say 6 months.
Gotcha.
Most people, they're calling 2 to 3 weeks before they take off, which usually is adequate enough because when you get the vaccine, if it's a single shot, it takes 10 to 14 days to get fully up and running in your system. So the day you get the injection, you start building immunity. And at 10 to 14 days, your body's immune system is going to max out how much it's going to protect you. So we always tell people, any time is better. Gail had told us an interesting story of a gentleman who gotten on an airplane for business travel and was sitting next to another gentleman. And he said, yeah, something getting these shots going to Africa. Have you ever been? He goes, shots? He had no idea that he should have gotten shots to go to Africa.
Wow.
So he quickly was calling places and finding out, and he actually was in contact with Gail, and she found a couple clinics in Africa that he could go to as soon as he landed. So sometimes, if you're going to be gone for a long period of time, it still pays to get that vaccine in your system.
Sure.
And most of these vaccines last a very long time. So some of them a lifetime if you finish the series. So it's great to just go ahead and get it started.
Right.
But I have people calling and saying, I'm taking off Sunday and it's Wednesday. Oh, okay.
Do people have to get a referral from a doctor to speak to you, or can they just call you up and say?
They can just call me up. I don't require a prescription from a physician. I should say rarely, and I'll explain that. But they can just call me. They're going on a trip. They can call and say, hey, I'm going to Ireland. Do I need to come and see you? For most industrialized countries, you don't need to. But we do have outbreaks of hepatitis A in everywhere in the world. So in Finland and Spain last year, there were some hepatitis A outbreaks on some of the spices and the fruits. So you don't, if you don't realize it, and now hepatitis A is actually given as a standard vaccine to children. But there's a large group from people born 2000 and back that never got it. And it's a food waterborne. It's a lifetime if you finish it. So why wouldn't you? You really want to be sitting in the bathroom getting sick the whole time? No.
Especially when you're on vacation trying to enjoy it.
Right.
Yeah.
So occasionally I'll have somebody that comes in and their health history is quite extensive. So I'll review it. I'll look at the vaccines. I'll look at allergies, medications. And if I have concerns, I will get in touch with their physician and discuss it. And if I have reservations about giving a vaccine, I can turn them down. Even if the person's like, I have to have this though, the yellow fever, it's mandated, I have to have it. Well, you're over 65 and you have a lot of health risks. I don't want to make you sick. So I'll call the physician and find out and go over everything and sometimes require that prescription from the physician. But by the time I'm done with the conversation, we're all on the same page.
Right.
So
I was just going to ask, and I think you kind of got into that a little bit, what would somebody expect as a consultation from you?
Well, first, you call me.
Yes.
Let me know where you're going and your time frame, and I do try to get you in as soon as I can, based on the time frame. And I request that you fill out a 3-page health form, which is on our website and on Facebook. I can also email it and fax it.
Okay.
It's a simple questionnaire that tells me where you're going, what kind of activities, humanitarian, vacation, visiting family, allergies, and if you know the history of your vaccinations. So it just gives me this rundown, and
Great.
then how long you're gone, because there are some medications that you take based on the term that you're gone. So if
Okay.
you're gone for 30 days and you need malaria medication, you're going to need 39 pills. So that's why I have this little line by line thing.
Yep.
And people go, oh, 3 pages? It's mostly check marks. It's really easy. If you can't fill it out prior to coming, you have to figure a little more time for your appointment.
Right.
Most appointments are about 60 minutes, and that includes the consultation. So they'll come in, I'll have their form, we'll read it, go through everything, decide what they want, give them their shots, finish their education, and then they're on their way. I do have some people who just want to get the consult and then decide. So those visits are more like 30 minutes, but then you have to come back for shots. I try to do one-stop shop because people have very busy schedules.
And why not make the time if you know you're going to be traveling to a country that you could get sick, to make that time now so that way you can enjoy yourself when you're out there, or not come back with something, you know, and travel back to the United States with something and then get sick
Right.
and expose other people to it.
And
I'm
there are
assuming.
some things that you can get. Malaria is one of them. It can take up to 6 months for the larvae to finish its cycle in your liver.
Ugh.
So there are certain things that people just, I don't think, realize. So when they come in, I try to hit all of those points so that they understand. I mean, people that are traveling right now, if they're going to malaria-rich countries and opting to not take the malaria med, or perhaps they just get bit enough times that the med just wasn't quite enough, well, 6 months from now, you're going to be in flu season. The symptoms are very similar.
Yep.
So people think it's the flu. Well, I've already missed the 2 days. I can't get medication. So it's really important to understand, I was out of the country. I should go and see my physician because this could be something that attacked me there, and I'm just now getting the symptoms now.
Right.
And then you can get medication and get better faster.
Right.
So, but a lot of people don't realize that.
This is why I'm not a nurse. There's too much to know and too much stuff that I don't think that I would be, you know, the appropriate person to handle. So that's why I'm better at communicating to people about this. What type of education do travel health participants receive? I think we kind of touched a little bit about that, but could you get a little bit more detail?
Sure. So when they come in, I do look at what is their travel history. How much have they traveled? How much do they know versus, okay, you're a brand new person, you've taken 10 trips, you've been to Africa, you're going again. So I will tailor the education to what's going on in that area.
Okay.
At that time.
Sure.
So right now, if you go down to South America, Zika is going to be one of the first things I talk about. And chikungunya was last summer. It came to the Caribbean islands. It was never there. Now it is.
Oh.
So there are all these things that crop up in the news, and I give you the specifics about how to reduce your risk, you know, to protect yourself, and then what to do if you find out, oh, gee, maybe I did get bit by that, and what the expectation is for your treatment. Some of these things you just have to let them pass and take Tylenol to be comfortable. On top of that, I also look at how long is the flight, how many stopovers do you have, how well do you do with high altitudes. Maybe you're going, you know, somewhere and you've never been even to Colorado or Utah, and you're going somewhere in South America or in India, and you have these wonderful mountains that you're going to go up in. You can actually get sick. It's called altitude sickness. So I go over very specific things related to where you are, the vaccines you should consider getting, and any medications you might want to take in case you're gone for a while and you happen to bump into something, and how to self-start those. So I give you kind of all these little background pieces. We go over insect precautions because there's a lot more than just mosquitoes out there. So it's very tailored to where you're going and what your background is in travel. And there are people that have traveled that have no idea. They only ever gave me the vaccines. I didn't know.
Yeah.
So maybe you don't need shots, but you do benefit from getting that education.
Going to the Caribbean, you know, I've never been, but you brought up a good point. That's something I wouldn't have thought of, that
Yeah.
I might want to check
Because
this
they're
out.
safe zones. People think of, oh, I'm going down to Mexico and to Cancun, or I'm going over to Puerto Rico, or, you know, the Caribbean islands. There are things you should be aware of that are out there.
Because up here in Vermont, for me, thinking, out loud to myself, I'm not thinking that there's a lot of things that are out there in Vermont that I could get sick by. I hear of, deer ticks and,
Right.
and things like that. But, I'm not thinking of all these other exotic diseases
Right.
or illnesses that I could get because I'm in Vermont. So.
Right. So you can avoid them with education or at least reduce your risk.
Now, I would also assume too that the individual who's getting ready to travel, you're going over their current medicine as well, so that way, excuse me, if they're taking something already, you would know that and already be able to tell if there's a conflict with whatever vaccine.
Right.
But there must be another vaccine that could work with whatever the medicine they're
Right.
taking, kind of thing.
Yeah, or you might have to come off your medicine if it's medically safe to do so. There again, I would work with the physician. Young women will come in and often be on birth control, and they're going to go overseas for 6 months to do a humanitarian study.
Sure.
So for malaria, they choose the doxycycline. Well, that interferes with the birth control. So there are things that you have to be aware of. A lot of people, if they go traveling, oh yeah, you need this script and this script. Maybe they've never taken that medication. So for some people who have not traveled and have not had reasons to take certain antibiotics, or they've not been on a malaria medication, I will encourage them to ask their physician for 2 extra tablets. Just pick that one little dose up, take it before you leave, because the last thing you want is to get on your trip and find out you can't tolerate the medication that was given to you.
That's true.
But
That is
nobody
true.
thinks of that. Oh yeah, doctor says I can have it. How many of us actually think about antibiotics for a standard cold that might make us not feel well?
Yeah.
So it's good to know these things before you leave.
I've had antibiotics before for certain things, and but I haven't ever had to take them that often.
Right.
So my first bout was 2 years ago, and I had certain reactions to it. And it wasn't until
Not
I
so
talked to
nice.
somebody at the VNA, and they're like, "Oh yeah, that happens to a lot of people, so you should just be prepared." And I'm like, "That would have been nice if
To know,
I
yeah.
had been told that, so I didn't think."
And there are things you can do for just the more common side effects of a medication.
Right.
But those are the things that we go over. Try to get really nice and deep into that education.
Well, and that's definitely helpful because, like I say, there's the people like me out there who are very green and just don't know enough to be able to say, I don't know what I'm doing. What types of vaccines does the BAVNAH Travel Health Clinic offer?
Any vaccine that is out there, we are licensed to give. We have a physician that is our oversight, basically. You don't meet with him, but he goes through all of our policies and procedures and approves them, and those are based on World Health Organization, called WHO, and the CDC, and the Canadian Health Ministry. They all kind of get together and say, okay, this is best practice. So
Okay.
we go through and we do that. The most common are your typhoid, your hepatitis A, your yellow fever, your Japanese encephalitis. Those are the most common we see for travel. But we do offer chickenpox, we offer Zostavax, measles, mumps, rubella, polio, and some physicians' offices don't keep vaccines. Vaccines are a particular thing that you have to refrigerate at a certain temperature, you have to keep records, you have to do
Oh.
all these lovely things. And doctors are just like, that's a lot of work. So they don't even have the vaccines. So then you
Yeah.
even have to find somebody who has them. Yellow fever, we do, is very, very specific. You have to have a special license from the CDC. We are a licensed provider of yellow fever. Not all places can give it.
I was just going to ask that. So that's pretty big to know too. Where to call to find out, who has this available.
Yellow fever is also one that it comes in 2 different formats. There's a 5-dose one, and then there are single doses. Most people buy the single because once you mix it, you have to use it within a certain time frame, which is 30 minutes.
Right.
So if you only have one person, you're not going to mix the 5. You're going to get a single. Well, the problem is the single doses, there gets to be a supply and demand issue. So you are limited to how much you can purchase. So again, it's one of those things. If you know you're going to travel and you're traveling to, it's mostly a belt through Africa and South America, call and make sure you can get your hands on that yellow fever vaccine, because there
Right.
could be a shortage. And I just recently had that happen. Guy called me back in November, December. There was a shortage. He called 5 places. Nobody had it. In the end, he got a clinic date for it. That clinic ended up not having it when he came in a month ago. And so he called me back and I said, I actually have some. Come on down. So
and jump on it
yeah.
while you can.
So, you have to be aware that there are shortages. So if you know you're going to travel, at least make the phone call to find out what's
Right.
going on with that vaccine.
And that makes sense too. I mean, and here again, those are things that, some people wouldn't think about. They just would think that it's a vaccine, I'm going to be able to get this anytime that I want, not
Right.
taking into effect that some of them have a shelf life, or some of them have to be mixed,
Right.
and they have to be used immediately, and
Right.
there's also restrictions on how much.
Well, and yellow fever is the only vaccine that is mandated worldwide. There are countries that will tell you you can't enter here without having it because you were in a country where it is, or there's a possibility of having transmission. They don't want it in their country. Other places there's a transmission risk and they'll say, yeah, you can have it if you want. You don't have to have it. We don't really care.
So do they have some documentation, the patients or something?
Yes, it's called a yellow card. Yellow fever, yellow card.
Gotcha.
And it's this nice long thing that you fold back up, and it folds back into about the size of your passport. And it has to have a special stamp for your licensed facility. And
Okay.
it talks about, the yellow fever, when you got it, it's good for 10 years and all this stuff. And you keep it with your passport.
Yep.
So yeah, that's the one that you have to have. Everything else becomes optional.
Interesting. Well, what do travel health participants need to bring with them for the consultation?
Themselves and their payment form. If they show up without their health form, they can fill it out, but they do have to just figure that extra 5 to 10 minutes. But typically, the health form has already come in. They bring any form of payment, check, cash, any major credit card. We cannot bill insurance for it.
Okay.
And then if they have their passport and they're getting a yellow fever, then I do encourage them to bring it. It's the only time I need it, because there's a spot where you put in the serial number of the passport
Okay.
on the yellow card. I've had people not bring it and just tell them, when you get home, fill this piece in.
Yep.
So that's really all they need to bring.
Okay. So it's fairly straightforward.
Pretty straightforward. A lot of people, what they'll run into is a problem filling out the immunization history. It's
Right.
not a required document per se, like you have to prove to me. It's, what are you aware that you've had? And our columns are yes, no, not sure. If I get your travel health form in advance, I sometimes can help track those records down when you sign the release, to see what you've had, what you haven't had. Do we need to play catch up anywhere?
Well, I was just going to even ask that too. Is there a way, if somebody doesn't know that they've had this, maybe, something happened, their records are lost, is it harmful if they take, another a vaccination, if they had one 10 years ago, is it harmful to take it again?
There are none that I am aware of. A lot of people are unsure if they've had the hepatitis A, there weren't good records. It won't hurt you to get it again. But one of the things you can do is you can get what they call a titer drawn through your physician. It's just a blood sample, and they'll find out what your immune level is and
Okay.
whether or not you need a booster, or you're still protected.
Gotcha.
A lot of people will do that with the measles, mumps, rubella, or the chicken pox.
Right.
Because again, there's this little period of time where people aren't sure, did I get the vaccine, did I not get the vaccine? Because when they're first introduced, not everybody's getting them. And then some people were hesitant with the measles, mumps, rubella. It's people that were born around 1957. It's questionable. Best person to ask is mom. Mom's still around, that's the best person to ask.
Yep.
Otherwise, if you really want to know for sure, you can have a titer drawn,
Okay.
and that will tell you whether or not you've had it or not.
And so you just said, as far as fees are concerned, that, you wouldn't be able to bill for insurance. So you just want to make sure that you have the proper form of payment with you.
Right. The one thing you can do is we give you a special receipt that has coding on it. So you can pull down a reimbursement form for your particular insurance, and you can send it in to see if you can get reimbursed for any of them.
Okay.
But we give you all the coding to work with that.
Yeah.
And sometimes you're lucky and sometimes you're not. I will say, if you do call your insurance company, you don't say, I'm going traveling, I need vaccines. As soon as they hear travel, they'll say nothing's covered, when in fact some of them are. They're considered preventative health. Hepatitis A is one of them, where it's more common for an insurance company to cover it. But if you say, I'm traveling and my doctor said I need this, is it covered? They're just going to tell you no. So don't say traveling, just say, does my insurance plan cover this vaccination? That's all you have to say.
And you would almost think that for me, you would think that the insurance companies would much rather have you be covered for the vaccination than have you get sick and then have you have to use your insurance for the recovery time period
Right.
of getting sick in the first place.
Yeah.
I mean, a $50 vaccination versus, several $100s worth of medical bills,
Yeah.
which one would you prefer? Not to mention the time loss and everything else.
Yeah, I think I'd rather just get that one little stick. Even if I had to pay for it out of pocket, I don't want to go on the other side of that and be the one who has to recover.
So what is the phone number? How can people reach you? And, again, you've already said that they don't have to get a referral from their doctor. They can just call you up to get a consultation. So what is the best phone number to reach you at?
They can call any of our main branch numbers and they can patch you through to my extension, which is 1536.
Okay.
Or they can call me directly, 802-770-1536. Or they can email me on my GoHealth, which is GOHEALTH at ravnah.org.
Okay.
And, I'm pretty good about getting back to people within a 24 hours of a call business week. So like if you call on Thursday, I don't work Fridays, Saturday, Sunday. So you'll hear from me Monday.
And I know when you and I email, I get a response right away.
Pretty fast, yeah.
So that goes without saying, and that's true. And so because of the fact that sometimes you're working in, different locations, the RAVNAH phone number up in Rutland, which I see you at a lot, is 775-0568.
Yep.
But today you're down here in Bennington, so that's 442. I have to 5502.
502.
I know all
We
these
have too
numbers.
many numbers. We have too many.
At least I can laugh about it, but that's great to know that people can just reach out to you and know that, okay, I'm going to be traveling somewhere. I don't know if there's something I need a vaccination for, but it's nice to know I can call the VNA and hospice, speak to Cathleen, and just find out, do I need something or am I okay?
Right.
And then, go from there and just come in for a quick consultation. We only have about a minute left. Is there anything else that you can think of that maybe we haven't, touched on?
Well, when it comes to the travel health, we do offer that to corporate. We offer it to schools. Some schools
Okay.
are required to offer the hepatitis B to the teachers and faculty. We will come to the school. Corporations that have their people traveling, we can go to the corporation and, take care of people there.
Like you were saying with Castleton. Yeah.
Yep. So, there are a lot of humanitarian groups out there that we also would go to. The Smile, there's another one for Vision. So all of these places, if they wanted us to, we could come and even just talk about what's going on in that area, and then they can make their decisions up. Or we can come and provide the vaccines.
Which is fantastic. So they can get the consultation and then make the decision on what they're going to be doing as far as that. But it's good to know that, again, they can reach out to you at the numbers that you just provided, your GoHealth at ravnah.org. And just reach out to you and just say, hey, we're potentially going to be doing this.
Right.
What are your thoughts and suggestions?
Have vaccine, we'll travel.
Exactly. Well, that's just about all the time that we have for today. Kathleen, again, thank you very much for being with me. If you have any questions, please feel free to visit us at BAVNAH.org or call us at 442-5502. I'm Marc Miele. Thank you again for watching Bennington News and Information.